I mean, one of the things that we're pleased about is that the conference brought together a lot of people who'd used forensic services, and they often get left out of service user involvement. People say it's too difficult. People don't really know quite how to do it.
I'm very glad to say that there is some representation here today from forensic mental health service users, and thank you very much for coming. It's not a group who get heard very often, and I would like to see in the future their presence here as well, up front, telling us about their experiences. I've had the honour of working with groups of forensic mental health services users over the last couple of years, and have seen them doing inspirational work. Very early stages of service user involvement in this area, but there are people who are breaking new ground and doing very important work, and I think that needs to be heard. The other group are people who have mental health problems but are denied services, or who find that the services that are on offer are not services they wish to engage with, who end up getting in trouble and end up often within prisons. And I'm not talking about a small number of people. When we look at prisons, we're talking about 60 to 70% of the remand population of prisons has at least one mental health diagnosis. And large numbers have 2, 3 or 4 diagnoses. We're talking about a very, very big problem. I work for an agency called Revolving Doors Agency. Revolving Doors alludes to the fact that the agency works with people who go in and out of the criminal justice system with mental health problems. And I want to say something very, very briefly about our service user involvement, to give a picture that actually things are happening within a voluntary sector organisation like that, and things that I think are important to hear. And actually I think my colleague here on my left is probably in a far better position to say something very briefly about service user involvement in this sector. So we're going to do this by me asking a couple of questions, and I'm going to ask Matt. Matt, how did you get involved in service user involvement?
Well, first of all, it's just I got asked to do it by one of the workers there, and to be honest, one of the main reasons that I did it was for the money, because I needed the money more than anything else. It wasn't to be out of the goodness of my heart. But, well, actually, it was a little bit out of the goodness of my heart. I wasn't that desperate for the cash, but 15 quid did come in handy. So it was just basically being asked to do it, and just saying how much it would help as well, what I could actually achieve by doing user involvement, by the big training and stuff like that. So it wasn't just the money, although I did say that. And I'm really sorry, I can't shut up sometimes.
All right, no, yeah, I'd like to hear a bit more actually, because I mean there's a lot of things that happen. So I mean perhaps you could tell something about some of the good and maybe some of the not so good things that have happened since you've been involved in service user involvement with Revolving Doors Agency.
Well, some of the good things that have come, I've actually been trained to actually give talks at conferences like this. Obviously the training weren't that good, but you never know. But I've been given training for that, also training on giving people interviews for everybody who's involved, who's employed by Revolving Doors. He actually got to be interviewed by a service user on the panel, except obviously my job, because it would be a conflict of interest. But there are a lot of pros to user involvement, especially now I've got this job. And it did take a while I've started working to actually gain the respect of the fellow service users, because they still saw me as a service user and not a member of staff. But now that's changed, we've got some more members. I'm actually given that respect, and I've actually got a lot of respect from the staff at Revolving Doors, because I've got the personal experience of being in police stations, I've got the drugs experience. So if they want to know about drugs, they just come and ask me.
We were able to get some funding last year, and Matt is now a member of staff, and a very valuable member of staff within the organisation. Because as an organisation, we're not just about providing services, we're actually far more about trying to engage with wider discussions and engage with the government. And being able to understand how that works is also incredibly important. And we are able to to engage with the Home Office, engage with the ODPM, Office of Deputy Prime Minister, and with the Department of Health, and try and influence them. And I think we need that kind of knowledge as well. So having a very a mixed organisation with a very diverse staff population, I think puts us in a strong position to do that. To finish, I'd just like to say one thing. The reason I came to here today is because of the initiative about setting up a network. And especially for small service user groups like the one at Revolving Doors, this is incredibly important. We're talking about a group of service users who are already very isolated. But also it's important to feel that as a service user group, they are also part of a wider service user movement. We hope that the initiative of setting up a network would increase the opportunities for that. So coming here today is about, not just about talking about it, but we would like to see some action that's moving forward, so that we can say, actually today is actually a point in history that we can look back at and say something started here that is going to make a difference for the coming years to the service user movement as a whole. Thank you very much.